I'm pleased to be joined today on Health Beat by Dr. Tristan Hartzell, hand, plastic, and reconstructive surgeon with Faith Regional Physician Services, hand, plastic, and reconstructive surgery here in Norfolk. And today, we're talking about carpal tunnel syndrome.
Carpal tunnel syndrome is the most common problem I see in my clinic, and it's my most common operation too. We do hundreds of carpal tunnel releases a year. What it is the nerve is squished at the level of the wrist. So there's multiple nerves that go to the hand. There's three main ones: the median nerve, the ulnar nerve, and the radial nerve. The median nerve is the nerve we're talking about, and it goes through the wrist in a tunnel. On the floor are bones. And we can see here from this picture, Rob, the floor is bones, the wall are made up of bones, and then the top is this transverse carpal ligament. And that is a tunnel that 9 tendons go through in that one nerve, the median nerve.
Wow.
When that tunnel is too tight, the nerve is getting corked off. It's not getting enough blood to it. At first, it screams for help at night because we all go back to our fetal days and we curl up in a ball and we bend our wrists down, and that squishes the nerve even farther.
Sure.
So the earliest symptoms are people wake up at night, their hands asleep, and they shake it out, hang it down, they get the blood back to the nerve, it wakes up, it stops tingling. Over time, it continues to not get enough blood to it, and then it starts to die. And then you start losing sensation to your fingers, and you start losing sensation to your thumb. Initially, we try and treat it conservatively. We try splints and anti-inflammatories. Sometimes we'll do a steroid injection to buy time. Those buy people about 3 to 6 months. But ultimately, we have to move on and do a carpal tunnel release. There's no magic pill to make that tunnel bigger. It's just a mechanical constriction problem. I can't have you take a pill and suddenly that tunnel's going to be a lot bigger. I have to go in and open up that tunnel. And this diagram here shows what we do. There's lots of different ways to open up a carpal tunnel. There's no one way that's better than others, just surgeons have preference. I happen to make an incision on the side of the wrist here, in one of the wrist crease, and use a video camera to go underneath the skin, protecting all the important stuff and opening up that roof of the tunnel. And you can see how it pops open, and now the nerve isn't squished anymore, and it can get its blood back to it and start to recover.
I'll be darned, that's pretty instantaneous?
It depends, great question. So people that come in early, they get an immediate improvement and they're back like they were when they were 10 years old. People that don't like doctors and tough it out, once the nerve has died, I can't make it recover. And so they often don't get that immediate improvement, but we do stop the progression.
Okay. Well, thank you very much, Dr. Hartzell, for joining us today on Health Beat, brought to you by Faith Regional Physician Services.
Thank you, Rob.
You're welcome.